Hello friends, a very good day to all of you. I am Dr. Kaustubh Chakraborty, a consultant neuropsychiatrist. As you all know, each year 21st October is celebrated as World Alzheimer's Day. This day is to remember the people with dementia who are suffering from it all over the world. Today I am here to talk something about dementia. Now we all know what dementia is. We diagnose dementia as a patient when someone presents to us with impaired ability to learn new information or to recall old information. He or she has one or more of the followings: aphasia, which is language disturbance; apraxia, impaired ability to carry out motor activities despite intact motor function; and disturbance in executive functioning, which is impaired ability to plan, organize, sequence, event, or abstract thinking. Along with this cognitive deficit will result in significant functional and socio-occupational impairment. So, this is the diagnostic criteria of dementia as per recent DSM-5 criteria. Now, there are several warning signs of dementia, and first and foremost is the memory loss, along with difficulty in performing various daily life tasks. The patient can have problems with language, disorientation to time and place, poor or decreased judgment. The patient may have problems with abstract thinking, misplacing things, changes in mood and behavior, particularly certain kind of delusion like delusion of theft, delusion of persecution. There can be changes in personality. Patient family often complain that he or she is not the same person who used to be, and there is loss of initiative. So these are the warning signs of dementia. Now, of the total cases of dementia, a huge proportion of the cases reside in LAMIC countries. As per the 2015 data, 58% of these people, demented people, live in LAMIC group of countries, which is expected to rise by 68% in the year 2050. Now, as far as Indian data goes, almost the 1066 dementia study group has shown to us that the crude prevalence of dementia in urban India is almost 7.5%, and the prevalence in rural India is 10.6%. So if we look at the age prevalence of dementia as per the ARDSI report in 2010, the prevalence of dementia in 75 to 79 year age group is around 5%, and with every 5 years increase in age, the prevalence gets doubled. As per this ARDSI report, by year 2050, the number of people with dementia in India will be 14.3 million, and that is a huge number. That you can see, that will be a huge number. Now, dementia has been categorized into various subtypes. The main subtypes include Alzheimer's dementia, vascular dementia, dementia of Lewy bodies, frontotemporal dementia, Parkinson's dementia, and mixed dementias. Other subtypes include alcohol-related dementia, which is also known as Korsakoff-Wernicke syndrome, Huntington disease, normal pressure hydrocephalus, and prion disease dementia, which includes classical Creutzfeldt-Jakob disease. Now, there are various reversible dementias as well. The main causes of reversible dementia are delirium, emotional disorders like depression, endocrine diseases, metabolic disturbances, eye and ear impairments, nutritional disorders, tumor toxic substances, trauma to head, infectious disorders, and alcohol and atherosclerosis. So these are the reversible causes of dementia. Now, in India, the prevalence of Alzheimer's dementia is the highest, which accounts for 50 to 75% of cases of dementia, followed by vascular, Lewy body, and frontotemporal dementia. Now, what is the reason behind dementia? Pathophysiologically, demented brain is characterized by plaques and tangles, which is the hallmark of Alzheimer's dementia. The brain of people with AD have an abundance of two abnormal structure, which is called beta amyloid plaques and neurofibrillary tangles. Now, beta amyloid plaques is generated through sequential endoproteolysis of amyloid precursor protein by beta secretase and gamma secretase enzymes, whereas neurofibrillary tangles are abnormally phosphorylated tau proteins. So these two get deposited in demented brain and person starts developing memory loss. Now, regarding talking about the management of dementia, there are two types of intervention. One is psychosocial intervention and one is pharmacological intervention. In psychosocial intervention, various kind of therapies have been tried, starting from reminiscence therapy, validation therapy, supportive psychotherapy, sensor integration, Snoezelen, reality orientation, cognitive retraining. This has gained much support as psychosocial intervention of dementia. Stimulation oriented techniques have been tried, like recreational activities, art therapy, aromatherapy, animal assisted therapy, and music therapy. While managing an aggressive patient with dementia, you need to stay calm. You would need to identify the causes and step into their shoes. Think how they are feeling. Reassure the person, listen to them, use distraction technique, and never punish them. In terms of pharmacological treatment, we have cholinesterase inhibitors. There are main three cholinesterase inhibitors like donepezil, rivastigmine, and galantamine. Memantine used for moderate to severe cases of dementia. Memantine is a N-methyl D-aspartate receptor antagonist, and it works on the theory that overstimulation of NMDA receptor by glutamate leads to progressive neurodegenerative damage. There are several treatments which are in the pipeline. Among those, I'd like to mention beta secretase 1 inhibitors and gamma secretase modulators. There are anti-amyloid antibodies or active immunotherapies, but they have failed phase 3 trials. Tau aggregation inhibitors or anti-tau antibodies. So these are the treatments in pipeline. A dementia vaccine has also been postulated to ward off dementia, and it has been successfully tested in animal models. The research is looking to develop effective immunotherapy via dual vaccine, which can remove brain plaque and tau protein, which is linked to Alzheimer's disease. It has shown some success in biogenic mice model, but human trials is still awaiting. So I think I have been successful giving a glimpse of what dementia is. We need to take care of them because in old age anybody of us can develop dementia. So let us not a certain way celebrate this day, but take a pledge to take care of these persons, elderly persons who are our parents, grandparents, and in future it can be us also. So all the best to you. Thank you.